Hello, I'm Marta Gandolla, and I would like to welcome you to this brief talk where I will drive you through a joint work of Politecnico di Milano and Villa Beretta Rehabilitation Center dealing with the evaluation of robotic gait training through EMG investigations. First of all, exoskeleton-assisted gait training is nowadays proposed in addition to standard therapy to improve patients' relearning. But classical clinical outcomes relies on behavioral evaluation, such for example gait speed performed by physiotherapists at the end of the treatment, but do not directly measure or gain objective measurement of the effective relearning process. So the objective of our work is to investigate the gait rehabilitation process in 28 subacute stroke patients and to evaluate relearning through EMG measurements. So we performed a pilot study with two groups, the control group with 14 patients and the experimental group with 14 patients as well. The control group underwent standard physiotherapy and the experimental group underwent standard physiotherapy with the assistance of bionics exoskeleton for the assistance of the overground gait. To be noted that the rehabilitation dose between the two groups was the same. And then we acquired EMG data also from 7 LT subjects. EMG signals were acquired from four muscles: tibialis anterior, soleus, rectus femoris, and semitendinosus bilaterally for both legs, so the paretic and non-paretic leg, and bilaterally for the LT subjects as well, and in two assessment points before the treatment and after the treatment. From the EMG profiles, we calculated the gait metric index that actually is an index that calculates the similarity between the patient's muscular pattern with respect to a normative one. So we can see in the figure we have the activation profile where we can identify some activation and deactivation windows. So the gait matrix considers the difference between the normative profile and the patient profile in terms of amplitude. So where the normative activation pattern is active and the patient activity profile is active, and in terms of timing, so comparing the activation windows between the two subjects, and it ranges between 0 and 1. So as for the results for what it concerns the clinical outcome measures, so what we have called before the behavioral outcome measure has been combined together to compose the capacity score, and both the control group and the experimental group showed significant increase between the measurements before and after the treatment. As for the EMG evaluations, we can see that the control group did not show any significant difference between T0 and T1 for any of the muscle analyzed, while the experimental group showed significant improvement for the muscles of the non-paretic limb, as we can see from the mean of the gait metric of the four muscles on the left-hand side, and the pair of non-paretic proximal muscles on the right-hand side, where with proximal muscles we intend the rectus femoris and the semitendinosus. As a conclusion, we can say that compared to both the standard therapy and the exoskeleton-based therapy led to a significant clinical improvement, while for what is concerning motor relearning that we investigated through EMG patterns, only the exo-assisted, so the experimental group showed a significant improvement. So actually we can hypothesize that the exo training guides the relearning process towards an LT pattern, and that the gait metric is a reliable tool to evaluate the rehabilitation process.